All are contents of femoral sheath except femoral nerve. So femoral artery, femoral vein and genitofemoral nerve are the contents of femoral sheath. Conjoint tendon is formed by internal oblique and transversus abdominis. Nutrient artery arises to fibula from peroneal artery. Root value of sciatic nerve is L4, L5, S1, 2 and 3. Site of injection in gluteus is superolateral. Major flexor of hip joint is psoas major. Trendelenburg sign is due to paralysis of gluteus medius. Inguinal ligament forms the boundaries of femoral triangle and Hazelback triangle. Length of inguinal canal is 4 cm. Deltoid ligament is attached to all except lateral malleolus. So deltoid ligament is attached to medial malleolus, talus and calcaneum. First web space of toe is supplied by deep peroneal nerve. Flexor of hip joint are all except gluteus maximus. So flexors of hip joint are psoas major, sartorius and rectus femoris. Flexion of knee joint is caused by hamstring. Adductor canal contains all except femoral nerve. It contains femoral artery, femoral vein and saphenous nerve. Tibial nerve supplies all except peroneus longus. Tibial nerve supplies gastrocnemius, plantaris and tibialis posterior. What lies at mid-inguinal point? Femoral artery. Abdomen. Which of the following stimulus does not induce visceral pain? Cauterization or cutting does not induce visceral pain. Length of spermatozoa is 50 micron. The first event to occur in the micturition reflex is relaxation of perineal muscle. Hydatidids of Morgagni are none of these options. Capacity of stomach of newborn is 30 milliliter. Corresponding to the vas in males, which structure penetrates the inguinal ring in females? Round ligament. All are supports of uterus except, so all these options are supports of uterus: uterosacral ligament, round ligament of uterus, Mackenrod's ligament and transverse cervical ligament. The sensory nerves from the cervix pass through the sacral 2, 3 and 4. The branches of internal iliac artery include all of the following except inferior epigastric artery. So which are the branches of internal iliac artery? Uterine artery, middle rectal artery and obturator artery. All of the following are branches of internal iliac artery except ovarian artery. So branches of internal iliac artery are superior vesical artery, uterine artery and internal pudendal artery. The principal factor causing the rupture of the Graafian follicle is necrobiosis of the overlying tissue. The superior rectal artery arises from the inferior mesenteric artery. Middle rectal artery is a branch of internal iliac artery. The blood supply of the jejunum is through the superior mesenteric artery. Appendicular artery is a branch of ileocholic artery. Recurrent appendicular artery is a branch of none of these options. The length of common bile duct is 8 cm. Caudate lobe of liver is situated IVC, that is inferior vena cava and ligamentum venosum. Transpyloric plane passes through L1, L2. Fascia of Denonviller is fascia between the rectal ampulla and the prostate and the seminal vesicles. Irritation of the diaphragm radiates to which of the following segment? C3 and 4. Nerve of Latarjet of vagus is seen in stomach. Pancreaticosplenic lymph node receive lymphatics from the part of the stomach which is supplied by short gastric arteries and left gastroepiploic artery. Most common type of diaphragmatic hernia is hiatus hernia. In portal hypertension, the site of portosystemic anastomosis include lower end of esophagus, around umbilicus, lower third of rectum and anal canal, extraperitoneal surface of abdominal organs. Normal portal venous pressure is 6 to 12 millimeter of mercury. One of the following does not normally shrink in the umbilical cord. Allantois does not normally shrink in the umbilical cord. Vitellointestinal duct, umbilical vein, and umbilical artery shrink in the umbilical cord. Over 75% of the strength of the intact abdominal wall is in the aponeurosis. Bowel does not get strangulated in which one of the following? In rectouterine pouch, it does not get strangulated. It may get strangulated in omental bursa, ileocolic recess, and paraduodenal and peritoneal recess. Renal collar is formed by splitting into two limbs and encircling the aorta by left renal vein. The least dilatable part of the urethra is membranous. In hydrocele aspiration, the needle passes through all of the following layers except tunica albuginea. So, which are the layers which are uh, pierced during hydrocele aspiration? Dartos, tunica vaginalis, and external spermatic fascia. During abdominal surgery, under local anesthesia, patient suddenly felt sharp pain. Injury to structure likely involved is parietal peritoneum. The lesser peritoneal sac or omental bursa is bounded anteriorly by the stomach and posteriorly by the pancreas. As a rule, all prostatic arteries are branches of inferior vesicle and internal pudendal. The lumbosacral, that is lumbar and sacral plexus, is formed within both the abdomen and the pelvis. It has branches that innervate the muscles of the lower abdominal wall. The posterior-inferior or visceral surface of the liver is related to the right kidney, hepatic flexure of the colon, duodenum, and esophagus. Buck's fascia is related to penis. Structure found in the superficial perineal space or pouch of the male include the bulb of the penis, bulbospongiosus muscle, ischio-cavernous muscle, and superficial transverse perineus muscle. The posterior wall of inguinal canal are formed by many structures that include conjoint tendon and fascia transversalis. Which of the following statement concerning the nerve supply to the urinary bladder is correct? So the sympathetic postganglionic fiber originate in the first and second lumbar ganglia. The parasympathetic ganglionic fiber synapse with postganglionic neuron in the inferior hypogastric plexuses. The afferent sensory fibers arising in the bladder reach the spinal cord via the pelvic splanchnic nerves and also travel with the sympathetic nerves. The parasympathetic preganglionic fiber arise from S2 to S4. The common bile duct is situated anterior to the portal vein and it is separated from the inferior vena cava by the epiploic foramen. The right suprarenal gland is related to inferior vena cava and right lobe of the liver. Which of the following statements concerning the anterior abdominal wall is correct? The fibers of external and internal abdominal oblique muscles are oriented perpendicular to one another. The muscles are innervated partially by lower intercostal nerves. The celiac nodes receive lymphatic drainage from the liver, pancreas, spleen, and duodenum. Which of the following statement relative to the gallbladder is true? Its fundus is normally situated on the transpyloric line at the tip of the ninth costal cartilage. It occupies a groove that separates the right and quadrate lobe of the liver. It is related posteriorly to the first part of the duodenum. Parasympathetic outflow from sacral plexus is nerve erygentis. The urinary bladder in the male is posterior to the pubic symphysis and anterior to the ampulla of the vas deferens, superior to the prostate gland. Which of the following statement is correct? The lesser omentum forms the anterior boundary into the lesser sac. The thoracic duct leaves the abdominal cavity by passing through the aortic opening. The bile duct, common bile duct, descends behind the first part of the duodenum. Superficial fatty fascia between umbilicus and pubis is fascia, Camper's fascia. In the female pelvis, the suspensory ligament of the ovary transmit the ovarian vessels. The posterior fornix of the vagina is related to the recto-uterine pouch of Douglas. The rectus sheath contains all of the following except genitofemoral nerve. So rectus sheath contains pyramidalis muscle, inferior epigastric and superior epigastric vessels. Which of the following statement about the formation of the inguinal canal is true? The superficial inguinal ring is an opening in the aponeurosis of the external abdominal oblique muscle. The anterior wall of the inguinal canal is formed by the aponeurosis of the external oblique and reinforced laterally by the fibers of the internal oblique muscle. The posterior wall is formed partially by the transversalis fascia. The deep inguinal ring is an outpouching of the transversalis fascia and is situated lateral to the inferior epigastric vessel. The normal constriction of the ureter are found where the ureter begins at the junction of the renal pelvis and the ureter, where the ureter passes through the bladder wall, where the ureter crosses the common iliac artery of the pelvic brim. The chief blood supply of the greater omentum is right gastroepiploic and left gastroepiploic artery. The boundaries of the Morrison's pouch are inferior surface of liver, peritoneum over right kidney, and coronary ligament. The following about prostate is true except has an anterior lobe which hypertrophies in old age is incorrect. It surrounds the neck of the bladder, has median lobe between urethra and ejaculatory ducts, has a posterior lobe which is prone to carcinomatous change. It is true that the gallbladder is drained by veins into the liver. It has a fundus which project beyond the liver. The superior mesenteric artery arises opposite to the which vertebrae? The celiac axis arises from the aorta opposite to the T12 and L1 vertebrae. Deep inguinal ring is a defect in the transversus fascia. Commonest type of inversion of testis is anterior. The following statement is correct concerning the vagina except that the upper part of vagina is not covered with peritoneum is incorrect. So what is true is the area of the vaginal lumen around the cervix is divided into 4 fornices. The upper part of the vagina is supported by the levator ani muscles and the transverse cervical ligament. The perineal body lies posterior to and supports the lower part of the vagina. Carcinoma prostate commonly occurs in the posterior lobe. The right adrenal vein drains into the inferior vena cava. The broad ligament of uterus has running innate uterine vessels, uterine tube, and ovarian ligament. Which of the following statement concerning the ovary is correct? The lymph drainage is into the para-aortic or lumbar lymph node at the level of the first lumbar vertebrae. The ligament of the ovary extends from the ovary to the upper end of the lateral wall of the uterus. The obturator nerve usually lies lateral to the ovary. The shortest part of the colon is ascending colon. Parasympathetic supply to rectum and anal canal is S2, S3, S4. Lymphatic of the anal canal is to inguinal lymph node. Which of the following about Meckel's diverticulum is false? That it arises from the mesenteric border of ileum. What is true is it is present in 2% of population. It occurs at 2 feet from the ileocecal junction and possesses all 3 coats of intestinal wall. The structures in the free border of the lesser omentum anterior to posterior are common bile duct, hepatic artery, and portal vein. Lymphatic drainage of the umbilicus is to axillary node and inguinal node. Uterine artery is a branch of internal iliac artery. The left testicular vein drains into the left renal vein. Which of the following statements concerning the function of the muscle of the anterior abdominal wall are true? They laterally flex and rotate the vertebral column. They support and protect the abdominal viscera. They assist in increasing the intra-abdominal pressure during micturition and defecation. Length of the inguinal canal is 3.75 cm. The kidney has 5 Probably pyramids. The smallest branch of the celiac axis is left gastric. Hazelback triangle is inguinal triangle. The boundaries of the Hazelback triangle are all except medial border of pyramidalis. So boundaries of Hazelback triangle are lateral border of rectus abdominis, inguinal ligament and inferior epigastric artery. The neurovascular bundle in the anterior abdominal wall is situated between internal oblique and transversus abdominis. The contents of the inguinal canal passing through the internal ring are all except ilioinguinal nerve and inferior epigastric artery. So what are the contents of the inguinal canal passing through the inguinal ring? Vas deferens and pampiniform plexus of veins. Fascia extension of lacunar ligament along iliopectineal line is known as Cooper's ligament.